everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to answer the question, is heat or ice better after knee replacement surgery? Hey everyone, so this is probably one of the most common, if not the most common question that I get in the physical therapy clinic from people after knee replacement surgery. And the question is, should I use heat or should I use ice after knee replacement surgery? And the answer is you can use either, or you can use none of them. The debate between heat and ice or heat has really gotten blown out of proportion, and people put way too much weight and consideration of the positives or the negatives of one or the other. The thing to think about is they've done research and they've looked at people who have used ice and used icing devices after knee replacement surgery, and then they compare people who don't use ice and really the outcomes clinically. So the outcomes in terms of your recovery and your results and your success or failure from knee replacement surgery really doesn't change depending on how much you ice or don't ice your knee. Now the supposed benefits of icing the knee are, it helps kind of restrict those blood vessels, decreases swelling, manages swelling and inflammation after surgery, and provide some pain relief. And these things can be true. I think the biggest reason you want to use ice is that pain relief aspect to it. It helps to kind of numb the area, provides a new sensation to the area, and is really helpful for pain management. And especially, I think early on after surgery, that first few days, that first week, that pain management is really, really important. And icing can be really helpful and can also be helpful for keeping your swelling and inflammation in check, relatively speaking. Now, at the same time, if you don't use ice or you don't use ice a ton or very limited, it's not the end of the world. Swelling and inflammation is a normal part of your body's healing and recovery. And, it's not bad. It's normal. It's going to happen. It's part of that process. So, trying to restrict it like swelling and inflammation is this evil thing that is very bad and is going to hurt you and cause damage. That's not the case. It's a normal part of the healing process. So it's okay if you have some of this going on in your body. So that's the reasons for using ice. For heat, the heat is again something provides that pain relief, provides a new sensation to the area, can help relax any type of tension or tight muscles that you have and help tolerate different activities and move a little better and feel a little looser and tolerate things more. So heat is very valuable too. And the thing with heat, any type of heating device that you use, is it's very superficial. It doesn't penetrate very deep. And same with the icing. It's not going to penetrate very deep into the knee joint itself. It's going to be on that outer layer of the skin and the epidermis where you really feel it, and it's really going to penetrate. Otherwise, it's not going to get that much deeper. So, sometimes you hear the argument against using heat that it's just going to further increase your swelling. It's going to increase inflammation by causing the blood vessels to dilate and more blood flow and more swelling to the area. I don't think that's really going to happen, and I don't think that happens, and it's not harmful in any way to use heat. I use it with many patients after knee replacement surgery. As you think about, you take a hot shower or you take a bath once you're cleared and able to do so, you think about the temperature of that water when you take a shower. It's probably similar, if not hotter, than what you're doing when you put heat on your knee. So it's not going to cause any harm. It's not going to delay the healing of your tissues, really. It's okay to use heat. So I would say use either. If one of them provides pain relief makes you feel better, makes you able to tolerate things better, stick to that one and try that one some more. If you don't like them, you don't tolerate them, it doesn't feel good, it seems to be a waste of time, then don't worry about it. It's okay that you're not doing it all the time. Give it a try. If it seems to be helpful and beneficial, keep using it. If it doesn't seem to be helpful and beneficial, then it's okay to not use it or to use it sparingly. The best thing that you can do is focus on what strategies you have to manage pain and to be able to tolerate different exercises and different activities, and focusing on the physical aspect of your recovery, working on the range of motion, your strength, your functional movement and mobility, and getting back to doing the things that you enjoy and your daily activities. So to answer the question, should I use heat? Should I use ice? You could use one, you could use the other, you could use both, you can use neither. So it's up to you. It's not the end of the world, whatever decision you make. Hope this helps clarify that a little bit and you're able to make a decision that's most appropriate for you and your recovery and your circumstances. Be sure to subscribe to our videos. I post videos all the time, everything related to knee replacement, preparation, recovery, rehab, frequently asked questions, everything about the surgery itself. Check it out. Have a great rest of your day, and thank you for watching.